Welcome to this special edition of Colorado and Me, concerning COVID-19. I'm George Blaze. It's no secret that the recent outbreak of the COVID-19 virus has everyone concerned, and rightly so. Whether it's the obvious health risks for us and our families, or the potential long-range economic impact of this growing epidemic, now is the time to do everything we can to stay educated on the facts and to be prepared to weather this latest storm. In this episode, we'll be speaking with the Chief Operating Officer of one of the largest county healthcare systems in the nation, an ER doctor working on the front lines right here in Denver, as well as a nationally recognized authority in the travel industry. But first, here's an important point of contact where you can stay up to date on the latest info and guidance regarding COVID-19. A comprehensive overview of the latest updated information on COVID-19 is available by visiting the Centers for Disease Control website at cdc.gov/coronavirus. There you'll find everything from facts and figures to maps and many other helpful resources. Joining me now is Dr. Terry Mason, Chief Operating Officer of the Cook County Department of Public Health, one of the largest health agencies in the country, serving nearly 2.5 million residents across 125 municipalities in suburban Chicagoland. Dr. Mason, what a busy time, to say the least, for healthcare professionals across the country. You do a good job of keeping in check with other people in other regions to keep up on what's going on.
Yes, the Center for Disease Control, which is the national agency that will monitor and provide guidance for how we manage what we're calling COVID-19, which is the coronavirus, the novel coronavirus. So that's where we get our guidance by way of this, from the federal level, and at the state level, it would be the Illinois Department of Public Health.
Well, just to get people just brass tacks on this, the coronavirus, how does it differ from the regular seasonal flu? That seems to be a question people ask all the time.
Sure. It's just a different virus. The virus that usually circulates it has a different name. This is the novel virus that now there is a coronavirus that does cause respiratory or cough, sneeze, flu-like symptoms, but this one is brand new. So we have no vaccine, we have no medication for this particular strain.
Who is at risk at this point that we're looking at, that if you see cases coming in or popping up, what are the cases that are most dangerous, the ones that you're really looking out for?
The ones that we're most concerned about are in the elderly and those with underlying conditions, particularly heart and lung conditions, because as you know, the way the flu creates damage is it causes a respiratory problem. And if you already have a respiratory problem or a lung problem, you're a smoker, or you've had emphysema, or you've had some other kind of pneumonia or congestive heart failure, you're at higher risk because you're likely to get a much more severe case.
So that's particularly if you have an elderly person living in your house, or even a baby or a younger person. That's really something. Is asthma a factor here in terms of risk factors, or we don't really have?
Well, the baby, actually, the children do much better.
Oh, okay.
Children do much better with this. And actually, there is a strain of coronavirus, not this particular one, but there is a strain of coronavirus that kids are exposed to all the time, and they do very, very well.
Well, one of the things that's been changing as far as what we read in the headlines is how it's spread. People are saying that there's further distances now that they think it can last in the air or that can last on surfaces. What is the science as far as you see right now as far as how it's spread?
Well, it's droplets, and so those droplets come out of your respiratory tree and out of your nasal passages. So when you sneeze, that sneeze plume can go out as far as 13 to 14 feet. And so those droplets are in an aerosol in that plume. And if you happen to walk toward that or be in a room or inhale those droplets, or go into your respiratory tree by way of your nose or through your mouth, and they could then replicate themselves and start causing problems.
Well, certainly people are concerned about protecting themselves. Are there some best practices or some just practical things that people can do to protect themselves?
Absolutely. So your first line of defense for any virus is your immune system. So you want your immune system to be as tuned as possible, and that is you want to make sure you're getting plenty of sleep, that you're managing your stress, that you're eating a diet that has more fruits and vegetables in it, because those antioxidants are also very, very helpful. So those are the things everybody can do, young or old, to protect themselves.
Now, certainly we have a lot of seniors out here who are in the risk category because of their age and perhaps because of health issues. Should they be concerned about attending public gatherings such as church and these regular activities? Should they start to curtail that type of interaction in public?
We have not documented community-wide spread of the virus at this point, so we're not making any recommendations that people curtail big gatherings, going to church, or anything like that. But I would recommend if anyone has questions, they can always go to the CDC website, cdc.gov, and that is the central source of information for this and a number of other things.
And to that end, in regards to deciding whether or not kids should go to school or these other things, you want to follow the best guidance from the leading authority in your regional area.
That's right. So you go to the CDC, it'll give you things that are local for your municipality, and there's usually a hotline number if there's further questions.
In terms of hand sanitizers, I've heard there's different talk about what hand sanitizers work, if they don't work, if that's the first thing you should think about as opposed to washing hands. Just keeping yourself safe. Let's talk a little about washing hands and hand sanitizers. What are the best practices there?
I think washing your hands with running warm water works just fine with soap. It will do the job that it needs to do because the hand sanitizer, some of them can help dry your hands out a bit.
Right.
So what we're recommending, there's 3 C's. One is the clean, which means wash your hands with warm soapy water for at least 20 seconds. Clean your surfaces that you use often. Cover your cough, preferably with a tissue, okay? And contain. If you are sick, stay home.
And what are some of the symptoms, or what are the things that you would feel that you would recommend someone stay home? Because there's lots of different things going on. There's a seasonal flu that's still out here. Mm-hmm. Some people may just, catch a bronchitis or something. What are the things you need to really be careful for to start thinking about keeping yourself?
Basically, these are flu symptoms. So if you have cough, fever, chills, those kinds of things are the things that tell you that there's something going on. So you shouldn't be going out with a productive cough, fever. You should sort of self-isolate yourself because you could have, as you rightly pointed out, it could be just regular seasonal flu because seasonal flu is still active at this point in time.
The testing kits are going out and spreading more widespread across the country in the places you can get tested. When should you be tested?
Well, what I would recommend people do is always check with your physician. Because there are things and there's special ways, you just can't go get a test just yet. So what we recommend is people always see a medical professional to determine whether or not this is a case that gets elevated to your Department of Public Health. And then that's where the testing authorization at this point has to come from.
It's just basic math that as more people get tested, the number of cases that we see are going to rise. You shouldn't let that concern you as far as containment, or as an administrator, as a health professional. What do you do with that information to really put it in perspective?
Well, what we're looking for is there evidence that we have now community spread. That is it airborne enough in the community that people don't have to necessarily be coming in contact with a person, much like the regular flu. So when we see that, then we know that things have changed. So what we still advise people is to stay home if you're sick, and the other 2 C's that we just talked about.
Of course, people are out here going to the local big box store and stacking up on food and supplies and really prepping for like a survivalist. Do you recommend this activity at this point, or what do you say about that?
Well, there are some interruptions in the supply chain, and I think that people need to be guided by the availability in their community. As we get past this, and we will, those supply chains will begin to open back up again. So I'm not advocating people go and clean out the stores, but I think that you should have a reasonable amount of food available for you and your family and supplies that you need to maintain yourself.
And certainly, if nothing else, just cleaning supplies around the house. Are there certain ingredients you're looking for in a surface cleaning supply or item that will help?
Most of the disinfectants that we use, including common everyday bleach, will take care of these kinds of viruses.
Well, Dr. Mason, thank you so much for all your help.
Always so welcome.
Once again, for people, wherever they are, best place to get information is from the CDC website.
The CDC website or your local health department. But the CDC is for the entire nation.
Fantastic. Great information. Thank you for joining us.
Thank you so much.
Just as Dr. Mason stated, you can get a comprehensive overview of the latest updated information on COVID-19 from the federal government by visiting the Centers for Disease Control website at cdc.gov/coronavirus. Everything you need to know is right there. Healthcare professionals across the Denver metropolitan area are truly on the front lines in the struggle to diagnose, treat, and contain the spread of COVID-19. Joining me now is Dr. Neil O'Connor, emergency medicine physician with Health One. Dr. O'Connor is a Denver area physician affiliated with multiple Health One emergency departments. Dr. O'Connor, thanks for taking time with us today.
My pleasure.
Well, let's focus on what's going on in the immediate Denver metro area. The governor recently announced a state of emergency. How does that specifically impact what your teams are doing on the ground at this point?
Well, the state of emergency is important because it gives us access to supplies from the federal government if that becomes necessary. Currently, all of the Health One facilities in the Denver metro area hospitals have adequate supplies for both patients and the providers. But if the COVID pandemic spreads, having access to federal supplies may become necessary.
Now, as you well know, the situation is changing hour by hour, minute by minute at this point.
Yes.
Right before we started this interview today, the state of Washington imposed sanctions on gatherings of more than 250 people. The social distancing, how important is this in terms of containing our situation?
I think it's very important. I think we've seen if there are reports of the number of cases coming out of China are accurate, the isolation, travel restrictions, social distancing seems to be working. So I feel that that is at least a component of how we slow the spread of the COVID-19 virus.
Is there anything about the climate in Denver or the altitude that changes or affects the virology of this particular disease?
Not that I'm aware of. When I was looking at the World Health Organization map of incidence of the disease, and what you find is it seems that it's less of a warm weather. So the southern hemisphere right now seems to be less affected. So we'll see how that develops over time. But as far as I'm aware, altitude, humidity, I'm not aware that that actually affects the infectiousness of this virus.
And as far as you see, how can people around Denver better achieve containment? What can they do specifically as individuals and as families?
Certainly, I think the hygiene portions are the pieces that we've talked about. Frequent hand washings or using the hand gels. If you're sick, stay home. If you're going to an event, I think, again, trying to stay away from folks, not in close contact, especially people coughing, so that social distancing piece. So I think really social distancing and hygiene, I think, are the main aspects right now. I think over time, as testing becomes more available, we'll have a better handle on who's actually infected, and we can be more targeted in who we recommend, stay at home, avoid work, things like that.
Is the fact that there are asymptomatic people out here, is that very concerning to you in this particular situation?
My understanding of the infection is that the transmissibility is much lower for asymptomatic patients. So unlike measles, where you have a high risk of spread even when the index patient is asymptomatic, with COVID-19, that seems to be less of an issue. Not to say it's zero, but it's at least a little bit reassuring that people who are typically symptomatic are the ones that are most infectious. Again, I think we all should be cautious and, again, avoid close contact, avoid, honestly, unnecessary handshaking. We should be, distancing ourselves from folks, frequent hand washing, things like that.
It's great that we're able to use technology in different ways today, especially when we're talking about the social distancing. I understand telemedicine and being able to see clients and hear from clients without actually them being physically on the presence has to be helpful in this situation.
Absolutely. I think that's going to be and what we've seen in China is the real boom in the amount of telemedicine visits. I feel that not only the new visits, but also when we're dealing in situations where there's in and out of the room, we'll be able to use telemedicine to reassess our patients without having to go back in the room and re-exposing the other staff members to the virus. So I do feel it's going to be a big part of managing this pandemic.
I understand that drive-up labs are also being distributed more widely. How does that exactly work? I don't think you can just drive up to it. There's a process to this as well.
Yeah, my understanding, and I haven't seen it personally, my understanding is that for all of the testing, you will still need a physician order. So I think that is yet to be fully operationalized. And this is one of those things that's going to be, changing by the day.
Clearly, an individual's overall health plays a role in protecting yourself and making you less susceptible to diseases in general. And of course, people in Colorado are very healthy, very hardy people. How does your personal health play a role in protecting you?
What we're finding is non-smokers, people who don't have comorbidities such as hypertension and diabetes, tend to do better and tend not to have the severe illness requiring hospitalization or admission to the intensive care. So definitely general health makes a big difference in this illness. So we're fortunate to live in such a healthy state.
Residents are, of course, reacting to this in different ways. Some people are seeing people with masks on television or in the media, so they think that you have to immediately go out and get masks or immediately go to your big box store and start stocking up on things. What is your advisement for either of these situations? Do masks help?
Masks are helpful for healthcare workers, and they're helpful for people who have been exposed to COVID. And generally, if you've been exposed and you're asymptomatic and you're going to be out, I think the recommendation is to wear a mask. On the other hand, if you've got no known exposure and you're asymptomatic, masks are generally felt to be unhelpful. Certainly for the healthcare workers, masks are critical to help reduce the risk of spread of the infection.
And for those individuals who have been diagnosed, what is the current treatment regime as it stands right now?
There's a wide spectrum of illness as it relates to COVID-19, from asymptomatic patients to those with cold symptoms to those with acute respiratory distress requiring ventilation and ICU admission. Fortunately, the number of patients who are severely ill seems to be relatively low, not zero, but if the Chinese numbers are accurate, hopefully less than 20% of total patients will require hospitalization or intensive care admission. So generally speaking, it is going to be an outpatient illness and with a range of illness from very mild symptoms to upper respiratory symptoms, flu-like illness to full-blown respiratory distress.
There have been reports of people who have recovered and then are reinfected. Is this from within, or is this externally in the environment? They're just picking it up once again.
That's a great question. I don't really have the answer to that. I think we need to understand the virology better and whether there's mutations going on or whether we're not mounting a proper immune response and we're getting reinfected with the same strain. So I think that's to be determined.
And it seems in many cases the goalposts are moving as in regards to when we can expect some kind of a vaccine out there. In your general understanding of how these things work, what's the time frame usually between identifying a specific virus strain and getting a vaccine ready to go out on the street?
I think in this case, it depends on a couple of things. I think they're going to start testing soon. It really depends on how quickly, how stable the virus is or how quickly it mutates. Will depend on how effective the vaccine would be. I would not expect a vaccine anytime within 6 months.
Well, Dr. O'Connor, thank you so much for taking time today. I know you're very busy. You're out there on the front line, so thank you for the work you're doing out there, and I'm sure you're going to be out there helping and saving a lot of people.
My pleasure. Thank you.
The Colorado Department of Public Health and Environment is your best local resource for COVID-19 information. Visit colorado.gov/pacific/CDPHE/2019-novel-coronavirus. There's also a toll-free helpline to answer any questions you may have about COVID-19. Just dial 877-462-2911. Concerns about the outbreak of COVID-19 have really had a major impact on domestic and international travel. Recent reports estimate that the airline industry may lose over $100 billion in revenue this year, and that number continues to climb as the virus spreads to new regions globally. Joining me now to give a little insight from the inside is Kendra Thornton, a nationally recognized authority on the travel industry. Kendra, thanks for joining us.
Thank you for having me.
Well, quite a situation we're having here. I remember back in 2005, my wife and I were on our honeymoon and SARS was going around. And aside from seeing a couple of masks at foreign airports, it wasn't a big deal, but we're in a completely different situation today.
Yes, that's right. I mean, obviously, this is an evolving situation, and travel is certainly on the front line of this. We're heading into a very busy spring break season, and people want to know, should I still travel? Am I safe to travel? Will I be able to come home if I travel?
And what is the advice that you're giving travelers as they're coming to you for these questions?
Well, we're really relying heavily on the U.S. Department of State and their guidelines and their travel advisories. Of the 195 countries in the world, right now, the U.S. Department of State has asked Americans to not travel to 4 of them as a result of the COVID-19, and that's South Korea, China, Italy, and Iran. They have also asked that Americans not travel by cruise ship because the CDC has said that cruise ships are an environment that can increase the risk of infection. So really, we're recommending to travelers that obviously are traveling to countries that the government doesn't want us to go to, that they cancel and postpone any of those trips to those destinations, as well as any cruises. Fortunately, the cruise lines are being very generous and allowing people 100% future travel credit. So if someone is booked on a cruise, they can contact the cruise line or the travel professional that helped them book it and just put off that cruise until they're giving people up until the end of 2022. So they're giving people some time to really reschedule, which is great.
So the major leaders in the industry are really being a little more flexible with consumers, especially now, because they don't want to lose the business or lose the revenue. For people who've already booked flights or booked trips who might be changing their mind about flying somewhere, are there some discounts? Are there things happening? Are they forgiving some of the cancellation fees out here?
Yes, and this is definitely a moving target on a daily basis, and it really does vary by airline, certainly by hotel chain, what kind of cancellation penalties are being relaxed. In general, obviously, airlines, if they are canceling a flight, whether it's because the flight was going into an infected area or because, just for load factor reasons, you could certainly ask for a refund and get your money back. For those people who just don't want to travel, but perhaps are traveling to a place that's not listed as a concerned destination, then the airlines have relaxed their policies in terms of waiving those rebooking fees, and so allowing people to maybe postpone their travel to a later date. Typically, they're giving people within 1 year of when travel was to happen to reschedule that trip. So that's another way. And I will say, certainly, what we're seeing in the travel industry in terms of these relaxed policies is unprecedented. We haven't seen this kind of cooperation and flexibility from the travel industry in a long time.
And we're seeing the kind of things happening as well in the hotel industry?
And the hotel side, it's definitely specific to the destination. Of course, if you were traveling to Italy, which we had a lot of clients with my travel agency flying and traveling to Italy for spring break and early summer, in a lot of those cases, you can't even get into that country, obviously, now. So yes, you would see some refunding happening there. But in most other places, it's pretty hard to get your money back if you're canceling just because you don't want to go or because you're afraid to go. And that sort of leads into the whole travel insurance situation. Obviously, it's always wise to add a travel insurance policy whenever you're booking a trip, especially if it has very restrictive cancellation policy, so that you can protect your travel investment. What we're seeing is with travel insurance, in most cases, fear of a virus or a virus outbreak is not a covered reason. People really need to look at their specific insurance policy if they want to cancel a trip and have insurance on that trip to see if it would apply. But in most cases, we're not seeing travel insurance policies, claims being approved because people don't want to travel as a result of this virus specifically.
Do we have any advice for people in regards to home sharing or Airbnbs in these kind of situations as to how to navigate in these waters?
I really would say that is something that people would have to reach out to the entity, whether it's VRBO or Airbnb, and get their take on how they're handling the situation. But I think in general, it's left very much up to the traveler to navigate those waters. I'm not sure how much support is there, but you would definitely need to check with them directly.
And of course, check in with a professional like yourself.
Absolutely. I mean, we have been able to rebook thousands of our own clients, help them with their airfares, navigating the hotel process, any package tours. The phone lines with the airlines have been hours, or cruise ship lines. We've had people calling us just saying, even though I didn't book my trip with you, can you help me get through to someone who can give me an advice on what I should do about my trip? So whenever you work with a professional, that's the beauty of it, because they kind of take that heavy lifting piece off of it and help you sort through your options and do the research so that you don't have to.
Well, Kendra, that's some fantastic information and advice, and we wish you well and wish you good luck in your business and in your personal life, and happy trails to you.
Thank you. To you as well. I really appreciate the chance to talk to you.
There is a great resource for travelers on the CDC website. Visit cdc.gov/coronavirus and scroll down to the travel information page. There you'll find information for air travel, cruises, as well as a risk assessment for specific countries. Log on and stay informed. Being informed is the best way to keep us all safe. Thank you for watching the special episode of Colorado and Me. I'm George Blaze.